Hello everyone, I am Dr. Gobind Rai Garg.
I am Dr. Apurv Mehra.
So here this video is for the discussion regarding the new pattern which has recently been introduced for the AIIMS exam.
Change is the only constant. This is what we have learned. This is also the tagline of iPhone X. Change is the only constant, right? So this is a dynamic world, and this method is to select out people who have worked hard.
Definitely.
One thing cannot change is 19 subjects and their topics. What sir prepared, what I prepared, and what you are preparing is important. Was important and will be important. That is not changing. Nothing is changing in MBBS curriculum. Whatever is clinically more seen will always be clinically more seen, will be clinically more asked. So what you have to understand is whatever hard work you have done is still secured. And to confirm that in the new pattern, whatever they are changing, they have mentioned just beneath the new pattern that the majority of the questions will be what have been coming.
Definitely.
Right, sir? So according to you and me, what is your word on this? That how should they take this new news?
So first of all, the pattern of study should not be changed drastically because we expect minimum around 140 to 150 questions out of the 200 should be old pattern question. That means single best answer type. So majority of the questions are like that only. We will discuss the changes what they have recommended, which new questions can be asked, but every question require knowledge only. So if you have studied good, then you can answer every type of question. So no need to worry at all. First thing.
So what he says is stay calm. If I was to appear of mid exams, thankfully I don't have to. But still, if I would have to, I wouldn't have changed drastically what I was doing the whole day, except for I would have been abreasted with whatever is occurring new. Now, instead of one pattern of question, there are 7 patterns which are going to appear. The first pattern is the classical pattern which has been coming since ages. AIIMS is the exam where you have +1 for a correct answer and 33%, that is 1/3 negative for a wrong answer when it's a single type answer. This pattern is going to continue and will constitute the majority of the questions. This is the only exam in the country where if you mark and keep it for review, your question is not counted. So my suggestion is do not keep into this trap because many people have suffered great deal on their ranks by keeping things for review which they could not autocorrect. So this is a paper where you keep on attempting marking the questions, but remember one point, majority will be +1, -1/3 single answer types. So what is your take on the first question, sir? What will they constitute majority?
Definitely, just like every AIIMS exam, the single best response type questions, they will include some images also as earlier. So the preparation is more or less similar for these type of questions. So no need to change anything. The important topics remain same and the preparation remains same. Okay. So some look for some of the images and keep on preparing as you have already prepared for AIIMS.
So we'll go in a quick glimpse on 7 types and then we'll give you examples of all 7 types. The second type of question which is there is multiple true false. Do we have some question base of this available, sir?
Definitely, we have some of the questions. Multiple true false question is just like PGI pattern question.
Right.
In this question, what they will give is they will give 5 options, and against every option you will have to mark whether it is true or false. So that means one question will constitute 5 questions. So every question will carry same number of marks, and if you make it wrong, same number of wrong. That means +1/5 -1/5. So here it is 100% negative marking. So we will advise that you should mark only when you are 100% sure, or not 100%. Obviously, if you are 70-80% sure, only then attempt that question because negative marking is too much in this case.
PJ November 18 rank 1 Sarthak Vadera was our student. We were talking to him on the pattern of the questions for PGI, and his word was, "Sir, I only attempted the choices which I was correct on." His perception was that PGI is 250 MCQs, 5 options each, so it becomes 1250 questions, true, false, true, false, true, false, true, false.
Definitely.
So this is the same pattern which has come to you, except for in PGI you have to mark only true. Now you have to mark the false also. So you have to select true and false against each option. And what is your recommendation, Dr. Gobind Rai Garg? Where and how much PGI paper should they practice, if they should, so that they have an idea what is happening?
So definitely here comes the role. You minimum need to practice 2 papers, latest papers of PGI, so that you get a broad idea of the number of questions or type of questions. Means this will determine how much knowledge you have, because you don't need to get a tukka that this question may be right, but you need to know all the 5 options here. So little bit practice is required. I will recommend 2 papers. What do you say?
Bilkul sahi, sir. I agree with you. I also want to make one thing. Now it has become very easy for you. You are writing AIIMS and PGI both. This confusion will get over now, because the preparation strategy in future will be the same. Agreed, in this exam, these type of questions will be less, but from November onwards, there will be huge proportion.
Definitely.
So the number of questions will keep on increasing, and people should attempt both the papers so that they are streamlining their preparation towards one goal.
Definitely.
And there will be overlap and exchange of question banks. Keep this thing in mind. So go through last 500 MCQs, that is 2 papers of PGI, to have a glimpse of how these questions are framed. The third one is match the following, sir.
So this is not classical match the following as we normally see. Normally what we have is 4 options on left side and 4 on the right side, and you need to match them. Yeah? So this is not that type. Here will be 4 options on one side and maybe 7, 8 or even 10 options on the other side. So what they have done is they are again checking how much you know, because you cannot just blindly think that if 2 options have matched, the other 2 you can easily match. So you need to know all of these options, and again here is negative marking is 100%. That means you need to, on the left side, suppose there are options A, B, C, D, and on the right side we have 1 to 10. Yeah? So you need to write against every option. Against A, the answer is 7. So you need to write that. Yeah? So that means there will be 4 options, 4 against 4 questions, and every question carries 1/4 positive marking. And if you are right, and if you are wrong, it is -1/4 negative.
So they will make you run for each piece that you eat now.
Definitely.
Earlier it used to be 4 on the left, 4 on the right. If you know 3, the 4th, automatically you know. But now they will make you run for every piece. You have to run for each penny that you earn. Earning even 1/4 mark is going to be costly. That is why it's going to be very close now. The mark schemes will be very close for everybody. But these are the questions which will be coming from the tables. I believe that all the important tables that we have should be seen, because these are the questions we directly picked up from the tables, and they generally will not be very easy, but they are easier of the lot.
Definitely.
This is what we believe. The 4th one is the sequential arrangement. Sequential arrangement means what is the sequence of alphabets. So they'll give you 4 options, A, B, C, D. I am giving you a very simple option, A, B, C, D. Arrange them. So answer will be 1, 2, 3, 4. That is A, then B, then C, then D. Now these are the questions which have got +1 and -1. So they have got -1 negative, which is a very crucial point here. The second point is, I have a belief that they will be easier ones. There will be, according to MCI, the questions which a student of MBBS must definitely get it correct. So this will be a question which you should not get wrong, but more importantly, attempt only if you are confident. Otherwise, it will take away +1, which is huge, 100% negative. So one correct answer in a single answer is +1 and negative is 1/3. This is not an area to guess. Yep. If these are 3 to 4 questions, the total paper which might come, if you guess out, ignore them. They are dangerous lot. But if you know them, go for it. I believe my take will be easy. What is Sarat got to take on this?
At least in this June or July session, they must be giving the easier questions, what I believe. From November onwards, they will keep on increasing the difficulty pattern as the students come to know that which type of questions are asking, and even you get the lot of practice also. Then the pattern will start becoming difficult. But in this session, I expect that they will be easier.
Coming to the next pattern, which is multiple completion. Earlier, when they released the prospectus in the first go, they had mentioned that this will be +1/4 and -1/4. But now they have corrected, amended that, and now they have made it +1 for the correct and -1/4 for the negative. So it has got 25% negative, like in NEET we have 25% negative. But this is a question which has got multiple answers combination. What is your take on this, sir?
So this is a question which is normally asked in UPSC exams. So in UPSC exams, what they do is they will write 2 or 3 statements, and then option all 3 are correct, only A and B are correct, B and C are correct, and this type of questions. So what is important is here the negative marking is 1/4. So you will lose lesser. So and from the options you can, if you are able to find out that one option is wrong, then you just see that if that option is given correct out of the 4 in 3 options, you can easily find out the answer. So here you need to apply your brain. Even if you do not know the answer, all the options you do not know, still you can answer the question. So read it carefully, I guess.
So the trick will be there. If you are able to pick up that trick, sir wants to say, you will be able to score in this question. The next is reason and assertion.
So you must have practiced these questions earlier during your PMT days. So in the PMT, AIIMS is known to give assertion reasoning questions. So same question will be here, but this question requires a lot of knowledge, in-depth knowledge, because they give 2 statements, and then you need to first find out whether both are true or one is false or other is true. And even if both are true, then you need to know whether the reason is the correct explanation of the answer or not. So here higher order thinking will apply, but luckily the negative marking is 1/4 only. So this question only with knowledge you will be able to answer.
So these are the questions which are classical, but you need to have in-depth knowledge to answer it. They are the questions who are very scoring. Sir will be giving you a few examples, and I was talking to him before the recording. He made a beautiful statement. Deal with each statement and then link them up. Do not directly assume that they are connected. So they have to be independently dealt with to arrive at an answer. We will give you examples. And then the last one, sir, extended matching, which is the hot cake. People are talking about it throughout the nation.
Now, what I will advise regarding this question is one of the, what I feel is will be a time consuming question. So there a theme will be given. On that theme, they will give some options, and then they will give some cases. So you need to choose out among those cases which is the answer from those options. Yeah? So basically the question will not be difficult, what I feel, but it will be very lengthy. Yeah? So you will get same 1 mark after spending around 2 to 3 minutes on one question, whereas for rest of the questions you can answer in 30 seconds. So what I will advise is don't waste too much time on these questions initially. So keep these questions for last, so that you can attempt other questions first and then go for this question.
I also want to say here, apart from the first one which has got single correct answer, the 6th one which is assertion reasoning, and this one the clinical area will be an area which will give you images.
Definitely.
So keep your mind open to it, start linking the images, see the common images from the textbook so that you are prepared from it. Before going ahead, I would like to speak about a very, very important thing here. This is the number 1 valued book. Valued means you write a book, it sells. That is number 1 seller. Valued book means you write a book and then that converts into results for the students. This is number 1 valued book amongst all 19 subjects across the nation for more than a decade now. Means about 1.5 decade now. I am proud to tell you that the authors of this book, the 2 legends, Dr. Gobind Rai Garg and Dr. Sparsh, keeping in mind the 7 pattern of questions which have come, have given an example in the beginning for each type dependent upon the ratio that they believe, so that you have a clarity while solving the MCQs. I will first of all, on the behalf of students and the faculties, thank you for giving in print a guideline on which lots of teachers, not only students, can understand the pattern. Grab your copy. This is number 1 valued book, highly recommended. This is what I believe. Congratulations, sir, and best wishes for this book.
Thanks
sir.
a lot.
This is
Thank you
Dr.
very much.
Gobind Rai Garg's soul and heart, his flesh and blood. This is what he has created for years. This is not written, it is created and carved. Now we will go to all 7 type of questions and we will talk about how we are going to solve those questions. Sir will be giving his way of teaching. I'll be talking about orthopedics. So we'll start with the first one. Single best answer. We've already gone into explanation. +1, -1/3. We call them type 1. We'll go according to sequence type 1 to type 7. Type 1, the first question, Dr. Gobind Rai Garg in his own final stroke.
So I will like to give you the examples of these questions from the day-to-day life, so you can easily correlate what type of questions can be asked. So just like every question, 4 options, which option is right? Like I think this question should be an easy one. Identify the men in black presenting this video. Yeah. So options.
The options, what I want to believe here with the question I want to see. I agree that this question is not so difficult to answer after you have been bored by two guys sitting here. But I always had a habit of solving questions. Read all the 4 options before you answer. Read all the 4 options before you answer, and to prove that, you should go from DCBA. Howsoever confident you are, पहला ऑप्शन हमेशा धोखा होता है, चाहे लाइफ हो चाहे एमसीक्यू. So here, पहला ऑप्शन धोखा नहीं है. That is the answer. But develop a habit of DCBA, down up, when you select the best answer, because in AIIMS they trick you up with the first answer and you mark it. So my belief here is go with all the option, but I think the answer here is straightforward. We will go with this one. I'll give you an ortho part. Most common tumor in bones of hand. When we talk about bones of hand, right? Most common tumor in bones of hand. So according to same, synovial sarcoma is seen around the knee, and chondroma is one option that I will consider. Giant cell tumor is again in the lower limbs, maybe in the bones, but not in the hands. And then exostosis, also called as osteochondroma, are difficult to pick up. So here the answer is N chondroma. So if you mark this answer, you score +1, and if you mark any other option, you will score -1/3. What I always say is attempt high. So if there were 200 questions, and if you talk to people who attempted, Umang attempted 198 questions in November AIIMS, and he was rank 1. So people usually go very high. Zainab in 2015 had 197 questions. Ravi went on to 198. Siddharth, who was rank 1 in the same exam, attempted 199. These are the scores which are high indicators. So these are the questions you should not miss out, and they will decide your rank. Worry about the rest, but this is the one which is the most important to be concerned about. If you get them correct, you are through. So this is what Sir predicted. 140 plus questions will be type 1. This is what. Now we go to the second type, type 2.
So these are the multiple true false questions, PGI pattern questions we already discussed. So there will be 5 options. Against each option you need to mark whether it is true or it is false. Correct option +1/5, wrong option -1/5.
So Sir's example again, the famous way. He loves to entertain. So he's got another question.
So you need to tell which of the following statement are true or false about the Bollywood actors. Saif Ali Khan is known as King Khan. Right, wrong? Obviously it's false.
Who is King Khan?
Just guess. Bhai of Bollywood is Salman Khan.
Shehanshah is Amitabh Bachchan. So Shehanshah is Amitabh Bachchan. So correct. This is again true. Dream girl is Hema Malini, obviously. Alia Bhatt is Einstein of Bollywood. I will leave it guessing because we cannot teach you everything. So this is not to be touch controversy. We go to second type. Choose the correct statement about articular cartilage. Now this is a PGI question which came in 2000 May 17. 2017 May PGI. This question was there. Now if you look at the question, zone 2 contains progenitor cells is wrong. So here this was not the answer in PGI. But here with the new pattern of AIIMS, you will have to write false. Zone 4 has calcified cartilage. It is true. So this was an answer there. So you had to mark there. Now you have to tick the true. Zone 3 has highest protoglycan content. True. Again you have to mark. Zone 1 has high water content. Zone 1 is at the top next to synovial fluid. True. And zone 3 has chondrocytes in low density. Did not have to mark, so false. So instead of PGI where the answer was BCD, here it is false, true, true, false. That is how you have to go. Now we come to the third type.
So match the following as we discussed earlier also, that there will not be equal number of options on both the sides. So one side will be 4 options and second side may be more than 4 options. So like going to the question, again 100% negative marking is there. For correct answer you will get +1/4, for wrong -1/4. Okay? So like from the prep ladder teachers you can find out which subject is taught by which teacher. Pharmacology.
So Dr. Gobind Rai Garg, we'll write 3 here.
Orthopedics.
I'll write my name.
Men in Black.
Men in Black.
PSM.
Our dear friend Dr. Vivek Jain.
And Anatomy.
Dr. Rajesh Kaushal with his famous hairstyle. So this is the answer, but you will have to select each of them. There are some extra names on the right. Each of them is a valuable friend, and all the teachers in Prepler are valuable friend. It is an example. So going to the next. In orthopedics, cocker splint, wrist drop, radial nerve palsy, cocker splint for it. If you look at the actions of lumbricals, so this is a famous actor teaching you action of lumbricals. Paralysis of lumbricals is called as claw hand, and when you correct claw hand, you bend the knuckles, it's called as knuckle bender splint. So for knuckle bender splint, we have to choose between ulnar and median nerve. Ulnar nerve is a better answer, so the answer is ulnar nerve. Aeroplanes makes your hands like aeroplane, so it is for brachial plexus palsy. And Dunlop traction, the famous AIIMS question, is for supracondylar fracture humerus. It is a table of splints which are given everywhere, from which I formed this question. Right side, there are more options. You have to earn for each thing. You have to mark till the last. This is going to be scoring pattern, but a little difficult, but scoring pattern.
So in this, I want to add that for these type of questions, you need to see the tables. So most likely these questions will be coming from tables. So the famous tables, common tables, you must see.
Common hai, common aayega. This is what you should remember. See the common things. Fourth type.
Sequential arrangement. So as the name tells, you need to arrange in the sequence, as Dr. Apurv earlier gave the example, A, B, C, D, arrange in the sequence. So important thing is +1 and -1. So same thing, 100% negative marking. So be careful.
So mark if you're 100% sure. You can't make a mistake in this. For example, who is your wife out of 4? You can't make a mistake. If you make a mistake, your life is over. So this is, don't make a mistake. This is very, very important. And going to Sir's legendary way of teaching.
So like we commonly nowadays any score in the cricket is not a high score. Any record, any score can be broken. So the question is, in increasing order, you need to arrange the double centuries who have scored in the one-day internationals. Yeah? So can you guess?
So Virat Kohli, Sachin Tendulkar, Virendra Sehwag and Rohit Sharma.
Virat Kohli, the great batsman, but no double centuries.
So first will be A, because we have to go in the increasing order. Now this is a pattern which you have to observe: increasing, decreasing, all, none, except. These are deciders in entrance exams. Never ignore them. 3 things which I always tell you people are on. They don't read all the 4 options. They are on all except. Now here they will are on increasing, decreasing, and then they will cry. और एक वादा करता हूँ मैं आपको, if they will ask increasing, decreasing का आंसर भी नीचे सबसे पहले होगा. Definitely. They will give you highlighted and आपका मन करेगा उसको पकड़ने का. So be careful that you follow what is increasing or decreasing and then think. So Virat Kohli, the legend batsman, has not scored a double century.
And one with the Sachin Tendulkar.
So in the same order, A, B.
Followed by Virendra Sehwag, 2 double centuries. And the hitman,
Rohit Sharma. So this is the order. 0, 1, 2, 3. So think about the reason why this has to be arranged. This again, I believe, will be a simple thing. So I have given you an example which has been given in the AIIMS prospectus. Now this is an auto question. Fortunately, they gave in the AIIMS prospectus. Arrange the tumors age-wise, and somehow Ewing sarcoma first decade is to be kept in mind because it can occur in first decade. Second decade is the most common age, but it can occur in the first decade. Osteosarcoma, the most common tumor of second decade of life. Osteoclastoma, also called a giant cell tumor, which occurs after 20 to 40 years of age, and multiple myeloma, which is 40 years. So the answer becomes 1, 2, 3, 4 in the same order. So you are increasing the age as you're going down. So this is again a pattern which you have to be careful about. +1, -1. We come to the 5th pattern, multiple completion types. In the earlier prospectus, they had a different mark scheme, but now they have corrected it to +1, -1 4.
So I feel this question is a little easier question due to 2 reasons. One, you will get a lot of hints here, and second, the negative marking is also -1/4. So lesser than the normal AIIMS negative marking. Normal negative marking is -1/3. Here it is -1/4. And second important thing, you will get a lot of hints here. So from the example, we can see which hints we're talking about. Like, which of the following are famous characters of film Sholay? Okay. So the options given are Gabbar, Rancho, Kalicharan, Nathula. Now suppose I don't know that which options were there or which characters were there, but I know only one option. Like Rancho, I know Rancho was from 3 Idiots, so it was not from Sholay. So I know B cannot be correct. Okay. So then if we see the options, if you see option 2, A and B are correct, so this cannot be the answer. If option 3 is seen, A, B and C are correct. So here also B is correct. So cannot be the answer. And lastly, all 4 are correct means here also they are saying B is correct. So it cannot be the answer. So even if I do not know the other 3 options, still I can answer the question. Okay? So here you need to catch the words. Don't think that you have not studied about this question. You do not know about this topic. Even if you know 1 or 2 things, you can answer this question. Okay?
You know what sir told? Rule out. Your probability of getting correct will be high. Here, difficult to select out the answer, easier to rule out what can't be the answer. This is the trick he has used in this question. This is what he has done. The examples are UPSC MCQs, what he suggested, and rule out options. If you are able to rule out option, finally what is left will be your answer.
Yeah.
So I'll give you an example on the same pattern. Perthes disease, which is avascular necrosis of the femoral epiphysis, which involves the age group 4 to 8 years. Right? Which of the following are true about Perthes disease? So they have asked about which of the following are true about Perthes disease. So what I know about Perthes disease is it's a disease which has about 20% incidence of bilateral and is more common in males. Now I want to look at the options which are given to me. Only A is correct. A and B are correct. A, B, C are correct. All 4 are correct. Now, which is the common answer in all the 3 options? B. Just like sir told Rancho. I need to pick up my Rancho here. So first of all, I need to see what about B option? Is it correct or not? So here B is more common in females, which I just told you it's more common in males. So it is wrong. So by sir's way, answer is A. I don't even know the entire knowledge about it. But the options are such that for me to contest in this MCQ, B has to be correct. If it is not, this is a very simple question where I only have to mark only A is correct. Now this is the trick he was telling me. Going to the type 6 assertion reasoning, दिमाग का खेल है, knowledge का खेल है, उसके काम आएगा जो ward गया है, clinic गया है. It is going to be useful for the person who has actually soiled out his days and worked hard, attended lectures. This is going to be a very, very useful pattern for hard-working guys, people who are sincere.
Now in assertion reason, obviously the question will be a little difficult. Means question will not be difficult, but choosing the answer will be difficult because you require a thorough knowledge plus you require interpretation also. Not only knowledge, you need to interpret that knowledge also. But luckily, the negative marking is 1/4. So you can attempt this question. Even if you are little bit less sure, I will advise you should attempt this question. Like we can see the option. Important here, you need to analyze both the options separately first, then try to find the link. Okay? So options, 5 options, as you must be aware from the UG days also. So they will give 2 statements. Out of the 2 statements, first of all, you have to find out independently whether both of them are correct or only one is correct. If both are correct, then you need to find out whether the reason is the correct explanation of assertion or not. Okay? Like coming to this question, Virat Kohli is best batsman of India currently. No doubt.
No doubt. Absolutely no doubt.
I may say that this is not the totally true statement. I will like to add Virat Kohli is the best batsman of the world currently. Okay?
Correct.
So India is obviously. Then second reason, and now second statement, keep this separately. It is true. Keep it separate. Now the second statement, Anushka Sharma is wife of Virat Kohli. This is also we know, right? So both the options are independently true. Now we need to find the link. Okay? So Anushka Sharma is wife. So he is the best batsman. Obviously, we cannot find that link.
We can't find an obvious link.
Definitely obvious. You need.
There might be something hidden here, which we cannot comment on. But still, there is no obvious link here. There is no scientific linkage here of the reasoning for the assertion. So we have 5 options, sir. Now.
So now both the options are correct, and the reason is not the correct explanation of the assertion. Okay? So I will go with the answer B.
B for Bombay. So we have 5 options. Assertion correct, reasoning correct. So first 2 options. Both wrong, last option. One of them correct, C and D options. So these are 5 options which will be constant in the exam. So you should be knowing ABCD kya hai. In multiple completion, they can change what is ABCD. But here A is assertion and reasoning both are correct, and reasoning explanation of assertion. Assertion and reasoning both are correct but not the explanation. Assertion correct, reasoning wrong. Assertion wrong, reasoning correct, both wrong. So there will be 5 answers. One will be correct, but these 5 answers are constant. So this you have to work hard. You should be ready that these are the 5 options you will get. Now what I have done, I have got an orthopedic question here. Supracondylar fracture humerus can cause complication, inability to flex the thumb. So fracture humerus, inability to flex the thumb. Now we know that it occurs. Why? The second statement, anterior interosseous nerve supplies flexor pollicis longus. Now why would supracondylar humerus cause inability to flex the thumb? Flexor pollicis longus does not arise where it is, so it cannot be a direct injury. So it has got a knowledge with supracondylar fracture humerus, which involves 4 nerves remembered by the mnemonic AMRU. Anterior interosseous, median, radial, ulnar in this order. Now when supracondylar humerus involves most commonly anterior interosseous nerve, now we need to think about what does anterior interosseous nerve supply. कहते हैं किसी की तारीफ करने के लिए 2 चीजें चाहिए, आपका दिल साफ होना चाहिए और आपके हाथ में anterior interosseous nerve होनी चाहिए. This is called as a sign of appreciation. Flexor pollicis longus of thumb, FDP of the lateral 2 fingers are supplied by anterior interosseous nerve. And a person who has anterior interosseous nerve वो ये बना सकता है, इसको इंग्लिश में कहते हैं Keelow-Nevin sign. Keelow-Nevin sign. We expect this question to come to you because people love, examiners love anterior interosseous nerve and posterior interosseous nerve. So Keelow-Nevin sign. Now what I understand is anterior interosseous nerve supplies flexor pollicis longus, lateral half of FDP, one more muscle. That's your homework. The third muscle that anterior interosseous nerve supplies is your homework. Look for it because you will thank us for one day because you will get a question anterior interosseous nerve. कोई पेपर नहीं बनता इस nerve के अलावा. So anterior interosseous nerve supplies flexor pollicis longus is correct. And when supracondylar humerus involves the anterior interosseous nerve, then a person cannot flex the thumb because flexor pollicis longus is gone. This also is correct. And what I want to tell you is the reason why a supracondylar humerus patient cannot flex the thumb is because anterior interosseous nerve supplies the flexor pollicis longus. So both are correct and reasoning is the correct explanation of assertion. Now imagine if you have to solve this question, what all you need to know. Supracondylar fracture humerus can involve nerves, order of involvement of nerve, their supply and their linkage. And now I want to tell you one secret. This is a question which has come from AIIMS May 2018 where a question was asked, supracondylar fracture humerus patient cannot flex the thumb. Which nerve is involved? Answer is anterior interosseous nerve. So all assertion reasoning questions will be repeats of what the questions have come or from the topics. Mind you, majority of the questions which will be coming from section 2 to section 7, type 2 to 7 will be repeats. I don't think so there will be new questions. If they are, they will be so simple new questions that you will be able to guess them like A, B, C, D. We go to the last and the final type, the much discussed in the world, extended matching type.
Now in this question, there are many things given. So first of all, they will give a theme. Theme means a topic. So on that topic, all the question will be based on. After that, they will give you some options based on that theme. Some options will be there. Then they will give you the question, cases. First of all, lead question will be given. So you need to, from those cases, you need to identify that lead. And then you will need to find out among those options what will be the answer. Okay? Now, important thing is the number of cases may vary. That they may ask only 1 case. They may ask 2 cases. They may ask 4 cases also. Okay? So total mark will be 1 for this question. But depending upon the number of cases, suppose 3 cases are same, so every case will have 1/3 mark. Okay? So we can take with the example.
Theme and focus politics. Answer option list: Rahul Gandhi ji, Narendra Modi ji, Arvind Kejriwal ji, Sheila Dikshit ji, Amit Shah ji, Sonia Gandhi ji. भगवान जी मुझे माफ करना, सबके आगे जी लगा दिया. But I am recording an official thing and we will be careful about what we speak. But भगवान जी मुझे माफ करना, सबके आगे जी लगा दिया. Next.
Now lead question is, that means what we want to find out from the cases. For each of these scenarios given below, identify the politician from the above answer list. Okay? So this is just for a joke sake, we are making the question. We doesn't want to hurt sentiment of any person. Okay? Now case 1, this person can put potatoes in a machine and convert them into gold. You must have got the answer.
But we will not tell you.
And then distribute in 35% equally. Okay? So
we will not tell you the answer.
So you need to find out what is the answer among those. Okay? Case 2, he has 300 pages report against some old chief minister and burnt it in front of her house pleading for coalition.
हमें पता नहीं है आंसर क्या है.
And last case, He can throw farther than any discus throw champion and has brought all black money back to India.
You can look for Dr. Gobind Rai Garg's WhatsApps and Telegrams for the answers. But here on the official statement, these are 3 questions which you should know. And that's how the question is given. 3 fancy terms. 1 is a theme, 2nd is the answer, 3rd is the lead question. They just don't mean anything. They are extra information. Extra information is beneficial. मैं आपसे क्वेश्चन पूछता हूँ, which is the most common tumor of hand? And now you will answer enchondroma because I had given you in the first question. But the most common tumor of hand is squamous cell carcinoma. Most common tumor of bones of hand is enchondroma. देखिए गलत हो गया. आपको पढ़ाया, 20 मिनट बाद आपसे पूछा, you got it wrong. Right, and now you are thinking, oh sir, because question में bone नहीं था. First type का question में bone था. Now here extra information. Extra information गलत नहीं हो सकता question, but it will consume your time. So these are not the questions to be done when you are panicking and you are short of time. These are the questions where you have to go quick, identify the key points, and you will get the answer. They will give you marks, but you will have to think about the time ratio. So my suggestion is go through the entire paper, complete single answers and complete single things. ऐसा ना हो इस एक क्वेश्चन के चक्कर में हम 7 क्वेश्चन छोड़ दें, वो सेंसिबल नहीं. But coming to this question now, the first thing will be theme. Theme means the answer which will be finally will be based on the theme. So there might be a disconnect between the answer list and the theme. So many answers can be ruled out just on this basis. The number thing, look at the answer list. There will be very common conditions. And number 3 is the lead, what they want to ask you. And then look at the scenarios. So keep 5 to 10 seconds on thinking what they're going to ask. Like this is the question which is there. Theme is infection. So answer infection over. Now I have to look at all the options. Acute osteomyelitis infection, chronic infection, transient synovitis infection nahi hai, rule out ho gaya. Now this cannot be the answer. Right? Subacute osteomyelitis infection, mycetoma infection, septic artery infection. So out of 6 options, just reading the theme I have ruled out one answer. This might happen, might not happen, but I'll give you an example. Second point, lead. Which of the following is diagnosis? So I have to reach to the diagnosis, which is going to be a very simple thing. For example, third level, identify the human being. Here, identify the condition. Now, I told you image-based question can come here. Now, a 22-year-old male presents with pain and deformity in the right lower limb. He sustained trauma in the same limb 2 years back. The X-ray of the patient is suggestive of. Now, this is an X-ray which has a deformed femur with holes in it, with change intensity. Now, this is a classical image of lower end femur, the commonest site of osteomyelitis, and a long history makes it a chronic osteomyelitis. So here I have given you one statement. So the answer will be C. You will score +1 because one scenario is given. Now I could have given you one more scenario. The one that came in neat. Lower end of tibia has a sclerotic swelling in the rim with low-grade fever in a child. Now in such a scenario, your answer will be subacute osteomyelitis Brody's abscess. Absent movement of a joint, septic arthritis. Multiple discharging sinuses, mycetoma. So they will be giving you different clinical scenarios, and more the scenarios they give, the value of the question will decrease. My perception, they'll give you 2 scenarios per question. This is my perception. They might give you 3, they might give you 1, but this is what I think. They will give you 2 different scenarios and you'll have to pick up the clinical witness, whatever I've given. So these are type 1 to type 7 questions. I am really happy Dr. Gobind Rai Garg created 7 examples of sports, of politics, of movies to make it on the lighter note. But we are extremely professional here to give you an idea what it's going to be like. But my final word, don't go for the new things. Old is gold. If you remember what has classically come, you will be through. Sir.
Definitely. Knowledge is everything. If you know the topic, you can answer any type of question. So you no need to worry at all. Number of questions which will be asked in this AIIMS are expected to be very less. Most of the questions will be old pattern type questions. So you just need to practice a little, and I hope we are giving some questions.
Yes. We are creating in Prep Ladder free All India mock for you guys on 6th of April all over India on all the 7 pattern questions with the experience of the 19 leading faculties in the nation. The paper will be built up, and on the latest theme it will be conducted, followed by on 13th April on the same pattern again for All India exam, free for everybody in the nation, followed with 3 more mock tests for the individuals who are registered users of Prep Ladder on 20th of April, 25th of April, followed by 29th of April. So these are the dates. Mark them. Go for the exams. This is going to be the highest conducting exam in the country. We are waiting for you. Are you ready? All the best, Dr. Apurv Mehra.
Thank you and all the best, Dr. Gobind Rai Garg.
Thank you very much. Bye-bye.